Good day, young docklings. Professor Mysterio is back with another medical mystery to feed your hungry brains. Don't get so cozy, younglings. It's only getting started, so buckle up and get ready to save some lives. Once upon a time, in the bustling town of Gastroville, there was a renowned detective of digestive disorders, Dr. Esophagus Holmes. With a penchant for antacids and a keen eye for esophageal anomalies, Dr. Holmes was faced with a peculiar case. Mrs. Pyrosis, a 45-year-old librarian, presented with a classic case of heartburn, regurgitation, and a chronic cough. Despite her meticulous diet journal and avoidance of late-night snacking, her geared symptoms persisted. Dr. Holmes pondered the initial management strategy for Mrs. Pyrosis, considering the 2004 GERD guidelines. So what will be your answer? I hope you chose right. Now let's move forward with our story. The correct choice was choice 1. According to the 2004 GERD guidelines, initial management should focus on lifestyle modifications and the use of treatment as needed. Dr. Holmes advised Mrs. Pyrosis to elevate the head of her bed and continue her diet journal, adding antacids to her regimen. However, after 4 weeks, Mrs. Pyrosis returned with no improvement. Dr. Holmes now considered the next step in her treatment, reflecting on the 2014 amendment to the guidelines. So what will be your answer? Well done, almost there. I know you would make your professor proud one day. The correct choice was choice 3. When PPIs or antacids fail to control GERD symptoms, the 2014 guidelines recommend offering H2RA therapy. Dr. Holmes prescribed an H2RA and Mrs. Pyrosis reported partial symptom relief. However, she soon developed dysphagia and weight loss. Dr. Holmes suspected a complication of GERD and ordered an upper endoscopy, which revealed an esophageal stricture. He now had to decide the long-term management for Mrs. Pyrosis. Let's tell that nagging examiner of yours that you mean business. Let's solve this riddle together. The big reveal was choice 6. The 2004 guidelines clearly state that patients who have had dilatation of an esophageal stricture should remain on long-term full-dose PPI therapy. Dr. Holmes prescribed this for Mrs. Pyrosis, and her symptoms were well controlled thereafter. The moral of the story: always keep abreast of the guidelines, for they are the map to the treasure of good health. Don't forget to visit theconceptuals.com to find many more mysterious stories that only you can solve.